All right, call to order the matter of the respondent, Mr. Patient, case number 8675309. Present are myself, Mr. Referee, the respondent, Mr. Patient, represented by his attorney, Mr. Attorney, and the applicant, Dr. Doctor, represented by his lawyer, Mr. Lawyer. Dr. Doctor has submitted an examination report, which I have reviewed and has been stipulated into evidence. Each of the attorneys also have received a copy and have reviewed it. With that, Dr. Doctor, will you please raise your right hand? Do you swear or affirm to tell the truth? I do. Mr. Lawyer, please begin with direct examination. Thank you, Your Honor. Dr. Doctor, please say and spell your name for the court. Doctor, D-O-C-T-O-R. Please tell us about your medical education. I graduated from medical school at the University of Hard Knocks, and I'm currently a first-year psychiatry resident here at the Edge of Sanity. And are you the treating physician for Patient? Yes. When was Patient admitted to the hospital? May the 4th. Please tell us about the circumstances that led to Patient's admission. Well, according to his family, Patient stopped taking his medications and gradually became more aggressive and erratic, and his family brought him to the emergency department. Have you diagnosed the patient with a disorder? Yes. And what is that diagnosis? Bipolar I disorder. And is that a mental disorder in the DSM-5? Yes. How did you make that diagnosis? Well, prior to and during admission, patient has only slept for about 2 or 3 hours each night. He's repeatedly become agitated and irritable. His thoughts and speech are very fast. He's constantly moving around the unit in various goal-directed behaviors. Because of the diagnosis of bipolar disorder, is patient a danger to himself or others? Yes. In what way? Well, he's repeatedly become agitated and threatened violence. He's not thinking clearly, and his insight is severely impaired. Earlier this morning, he was telling us we were interfering with his campaign to be elected president, but I don't think he can reasonably make sound healthcare decisions. Is bipolar I disorder a treatable disorder? Yes. And how is it treated? Medications and psychotherapy mostly. Is patient likely to benefit from treatment? Yes, I believe he is. Is it your clinical impression that patient requires inpatient treatment? Yes. Why? Well, as I said earlier, he's not thinking clearly and his insight is severely impaired. I think that because of the mania, he's quite impulsive. Yesterday he told us that if he left the hospital, he would start jogging on the interstate like Forrest Gump. And at this point, I think he needs constant nursing supervision. In your medical opinion, what do you think is likely to happen if patient were to leave the hospital today? Well, I think he would stop taking his medications and probably become more erratic and agitated. I'm also concerned about his ability to provide himself with adequate food and shelter. So if he left the hospital, you think he would be a danger to himself or to others? Yes. Thank you. No further questions, Your Honor. Any cross-examination? Thank you, Your Honor. Doctor, has patient been compliant with his prescribed medications? Yes. And has he made any improvement since admission? He's made some slight improvement. Has patient ever assaulted another person? No. No further questions, Your Honor.